We will now proceed with public commenter Krish Gundu. Are you able to turn on your camera and provide your comments?
Good afternoon. Can you all see me?
Yes, we can. We will start the timer now. Go ahead.
Thank you. Thank you so much for your grace and flexibility. We're having major issues with power and internet today because of the weather. So I really appreciate you being flexible. My name is Krish Gundu. I'm one of the co-founders and executive director of Texas Jail Project. Thank you so much for giving us this opportunity to be part of this meeting and to make public comment. I'm really grateful for this council. I heard some of the presentations, not all of them, but I heard the one on the suicide prevention, and I managed to look up the data for our county jails, and it looks like this year, out of the 136 deaths that were reported in custody in our county jails, 13% were suicides. 13%. And that's the ones that we know about. There's dozens of them that they haven't identified the cause of death yet. And one thing I was curious about is if something that this council has thought about is the lack of any lifeline, suicide line inside jails. There is no 988 inside jails. And looking at the national data on how the incidence of suicides is much greater in correctional facilities than the free population, I'm wondering if there's any effort to introduce some sort of a 988 feature inside county jails, which is where we desperately need them. I want to tell you about one such death this year. I'm not going to name any names. This happened in East Texas, but this is one of the worst instances that we have seen in our work of criminalization of somebody who had a serious behavioral health issue, taken to a behavioral hospital in East Texas in a state of crisis because they were trying to harm themselves. They continue to try to harm themselves in the hospital. And despite orders from the psychiatrist on staff, the emergency room decided to have the sheriff's deputies arrest him, take him into the jail, where he spent a week in suicide watch, wearing those green turtle smocks in a cold cell, with apparently no medication. And on the 7th day, he managed to commit suicide. After all, this was a very preventable tragedy. This is one we know about. There are so many others that we don't know how they happened, but they were clients of the state's mental health system. So I'm really hoping that this committee is looking at some of those stories and instances to see how we can prevent these kind of suicides that are absolutely preventable. There was no need for this young man to be arrested at the hospital where he was trying to harm himself and be taken to the jail and left there for a week without any medication and then allowed to succeed with his suicide attempt. So, and my condolences to all the speakers who have spoken before. I'm really sorry for your loss and hope you find some answers here. Thank you today for listening to me.
Thank you, Krish. I'm very familiar. First of all, you and I have had many conversations in prior years. I've changed roles at the agency, so I don't have the opportunity to speak with you so much anymore, but I'm very familiar with the work of the Texas Jail Project. And thank you all for the tracking of these kinds of incidences and the work that you all do. And it's noted your point about 988 access in the county jail environment. And Nan, I want to go back to you because I want you to know that I heard you, we didn't miss you. And to many of the comments that were made earlier, like yours, it seems like in terms of there being a real area of need, it is looking at respite, looking at services for individuals that have a co-occurring behavioral health and IDD diagnosis, or maybe a sole diagnosis of IDD. You mentioned respite specifically. And so I've got that noted is an area of need as well.
Thank you for your acknowledgement, Dr. Harvey. Really appreciate all your work. Thank you.